So our first thing on the agenda is our youth engagement training. And so we have Kyler here with us, and I will turn it over to him.
Hey everybody, thank you so much for having me today. If you haven't met me, my name is Kyler Groner. I actually graduated 2 days ago from the University of Tennessee with degrees in economics and philosophy, with a concentration in philosophy of science and medicine, and a minor in public policy. And this fall, I'll be continuing my education, pursuing a master's of public health as well as a master's of public administration. So I'm really excited to be here today and excited to get to talk to you all about empowerment and youth programming. Just to give you a little bit of my background on this topic, I've worked for about 3 years now on Project Hope, which is healing opioid use disorder through prevention and expertise. It's a federally funded project aimed at addressing the opioid epidemic in rural East Tennessee. So as part of that project, I helped to design and implement a participatory action curriculum for young people at a local Boys and Girls Club, which centered around improving community health outcomes relating to opioid use disorder. And a central component to that was youth empowerment. So let's see if I can get this. So this slide just goes over gratitude. Wanted to recognize that this is part of a federally funded project from the Health Resources and Services Administration. And this just provides a little bit of an overview of the presentation today. So first off, I wanted to do some introductions, get to know everyone and see what your all's backgrounds are, as well as what you're looking for in this training. And next, we're going to go over some empowerment strategies as well as implementation strategies for these. A lot of this is going to be drawn from different, academic articles and systematic reviews and things like that. But as you'll find, a lot of the information boils down to really intuitive principles. And so I don't want this to be a presentation where it's just me talking to you all. I really want it to be interactive, and I want it to mostly be kind of us collaboratively thinking through some of the challenges associated with youth programming, as well as strategies that we've seen that have been important in empowering youth. So again, a lot of this comes from different journal articles and things like that, but I also don't want to overlook the importance of experiential knowledge of directly working with youth. And then finally, we'll do some group activities and wrap up. So here's our objectives. So identify why empowerment is important in youth programming, list some empowerment strategies to incorporate into your day-to-day programs, discuss in concrete ways to use these strategies, and finally, we'll talk through ways to practice these skills. So I want to do an introduction activity. So it doesn't look like we have too many people on this call, so you can unmute yourselves if you want, or you can just drop this into the chat. But your name, your current kind of title or position, a fun fact about yourself, and then what age groups you typically work with, and finally, just what you're looking for in this training. What would you like to take away? How can we make this a beneficial training for you? And I saw a few congratulations in the chat, so thank you.
I don't mind going first.
Okay.
I'm Christy Smith, Director of Unicoin County Prevention Coalition, and I've been in this position since its inception. So I've been in prevention for close to 11 years this year. So as a director, I've only 5 years now. So, but also fun fact is well, I'm very sociable, but I just published a book in November of last year, and it's doing really well. And what I want to get out of this is how to empower our youth as well as the minority populations, whether it be the LGBTQ kids or whether it be the Hispanic population that we have in the county. But also to get them more involved, and be more open to different cultures too.
Yeah, awesome. Thank you. It's good to meet you. What, if you mind me asking, what's your book on?
It is on, it's a historical nonfiction on Lost Cove, North Carolina, a community that survived for almost 100 years in isolation.
Wow, that's really interesting. Well, congratulations on publishing it. And yeah, those were certainly some good comments. I hope that we can talk through some ways, especially to empower minority youth as well.
I don't mind going next. And I read part of, I'm working on reading Christy's book. It's excellent. I'm not a reader, so for me to be able to actually sit and read that, it is really cool. It's very good. My name is Trish Burchett. I'm the Executive Director of the Action Coalition up in Johnson County. I'm the farthest away from anybody that you can get in the state of Tennessee. I've been the director for the coalition for 4 years, since 2018. Fun fact about me is I enjoy doing community theater. Most of the age groups that our prevention works with are 12 to around 19, some 20-year-olds. And what I'm really looking for in this training is a way to get kids to want to be involved in this training when there or in a youth coalition when there are so many other activities through the school that they have the option of being able to do. How can I set this one apart and make the kids actually just want to do it?
All right, great to meet you, Trish. I've actually got a bunch of family up in Johnson County, Kingsport area. And I think that's awesome that you work with theater. Some of my probably most impactful, I did theater and speech and debate and things like that in high school. I'm from Morristown, by the way. And those were my most impactful educators, I think, through K through 12 were theater related. So that's an amazing activity. So good to meet you.
I'll go next. My name is Shannon Townsend. I am the CRC, which is the Community Resource Center Coordinator. I am a correctional counselor through Tennessee Department of Correction, and this is actually my very first meeting with this organization, and I'm glad to be here. I've been with corrections since 2018. I'm not sure if it's a fun fact, but it was a fun fact at one time. I did work at the health departments for 25 years. So we had some really good times there. And so I've been with corrections now as the correctional counselor and the coordinator for the Community Resource Center. So whenever there's a chance to explain more about what I do, I'll be glad to do that. So I'm just looking for resources in the community to help anyone that is justice involved.
Awesome. Well, great to meet you, Shannon. Thank you so much for being on the call. Certainly an important role that you have, and I'm excited to hear some of your knowledge, given that you've worked for so long in public health. So thank you for being on.
Hey, I'm Jillian Reese. I am the Executive Director of Carter County Drug Prevention in Elizabethton. A fun fact about me, I don't know if this is really a fun fact, but I have 4 kids that all play baseball right now. So I live at the baseball field. That's my fun fact. We do a lot of work with really all ages. We do a lot of parenting support. So we do everything from early infant mental health kind of things all the way up through really college age kiddos. So our primary focus is obviously teenagers and that age, but we really do lots of work with all age groups. And I'm just excited for this training. Our youth coalition is probably my favorite thing that we have or get to do. And so I'm always excited to learn more about better ways to engage with them.
Awesome. Thank you so much, Jillian. See, we probably have time for a couple more. Oh yeah, you go ahead. Sorry.
Yeah, I guess I'll go next. My name is Horace Pulse. I think everyone pretty much on the call knows me, probably except for you, Kyla. I work for the Department of Mental Health and Division of Substance Abuse Services. So I'm good friends with everyone on the call. Fun fact about me is it's interesting to hear that you just graduated. Congratulations. But I was once an intern, for the Division of Substance Abuse Services. And that was 20 years ago. And here I am today, so fun fact. So who knows, maybe you'll be an intern and maybe, they'll recruit you to wherever you go. And 20 years later, you will be sharing your same story. Who knows?
Awesome. Yeah. Well, thank you so much, Horace. And yeah, I hope I can get to know you a little bit better too as well.
So I can go. I am Alice McCaffrey with Sullivan County Anti-Drug Coalition. I'm the director here for the last 12, coordinator first and then director. I've been here for 12 years since we began. I guess my introduction to my fun fact is I probably shouldn't be in prevention that has so much environmental strategies involved because I hardly ever notice my environment. Therefore, I've been watching the wrong nest in the tree outside of my kitchen window for the last month and finally discovered that the small cardinals that have been flying around weren't the babies that were in the nest in the tree, but the nest was in a different place and they were the parents of the babies that I've been watching all weekend as they try to be fed on their time schedule, not when their parents come back. We work with kids from 12 and really till the end of life because we have a lot of different programs that we do here, and unfortunately, the end of life is happening too often for too many people. What I'm looking for in this training is what I'm always looking for is ways to engage youth that help them find their own purpose.
All right. Thank you so much, Alice. Really glad to have you on board today. We probably have time for another one or two people if they want to introduce themselves by unmuting, and if not, everyone else can just send some stuff along in the chat so we can read about each other if anyone hasn't met.
I can go next. My name is Brooke Jones, and I work at Carter County Drug Prevention. I do a couple of different things there. I guess my title is Family and Community Support Coordinator, and yeah, that's pretty much it. My fun fact is that I love Weird Al, and I get to fulfill a lifelong dream of seeing him in person in just a couple of months, so I'm pretty excited about that. I work with all ages, all ages, but I work a lot with families and parents, and of course I work with kids too. So from this training, I hope to just get some good experience and how to engage with kids and their families more.
Awesome. Thank you so much, Brooke. We probably have time for one more person if they want to introduce themselves, and then everyone else can just send some stuff along in the chat.
I can go. I don't mind. I'm Sandra Miller. I'm with Unicoin County Prevention Coalition. I am the Drug-Free Community Project Director. Fun fact, gosh, I'm a mom of three. My youngest just graduated high school, so that's a...
Oh, congratulations.
Yes, and we leave today for Murfreesboro. She qualified for state in shot put and discus, so we are headed to Murfreesboro today. And let's see what else. Training wise, what I would like to get out of the training is teaching kids to find their voice and use it for the things that are important to them. really wanting to start a middle school youth coalition and hoping to get some great pointers for that today.
Awesome. Well, thank you so much, Sandra. And yeah, best of luck at the state competition in Murfreesboro. That's really exciting.
Thank you.
All right, so my computer's freezing up a little bit on me. Let's see if I can get it to go to the next slide. Here we go. So like I said, I want this to be really interactive. So I just wanted to start off by getting some feedback from everyone else. What does youth empowerment mean to you, either just intuitively or maybe through what you've seen, your experiences working with youth? Just what do you think of whenever you hear the words youth empowerment? And also feel free to utilize the chat if you'd like. All right, so Nicole said allowing youth the opportunity and freedom to be themselves. Christy says having a voice. This one says helping youth overcome their anxiety or fear, being their authentic selves, to feel confident in standing up for themselves and what they believe. I certainly agree with all of these. It seems like a main theme of this is basically just autonomy, youth being who they are, their authentic selves. This one says letting them lead their own direction and future with minimal guidance. So yeah, so basically youth empowerment is youth having autonomy and self-directedness over their own lives. It's not dominated. Their life direction is not dominated by some type of external force or factor that's weighing them down. And this is more or less in line with what the literature says about youth empowerment. So here's kind of a definition that I tried to draw out that seemed to be the best description of youth empowerment that there is most consensus on. So youth empowerment has been described as the process by which youth or adolescents gain control over their lives. And so typically for youth empowerment to occur, there needs to be two factors in place. So first, youth need to have options available to them. They need to feel like they have some type of control over their lives. If youth aren't able to pick between different types of choices, obviously it's difficult to ascribe that situation as being empowered. But secondly is that youth need to have the confidence to affect change. So you can imagine a scenario where a young person has plenty of options available to them, but they don't feel empowered, they don't feel the confidence to be able to pick between those choices. And so because of their lack of confidence, basically they feel like they are restricted in what they can do. And so of course this certainly falls in line with what everyone else was saying of gaining control, of being self-directed, being able to be who they are with minimal guidance from other people, and being their authentic selves. So next I wanted to talk about why youth empowerment is important. And for this, we need to partly look at youth brain development. The brain development of youth has commonly been described as bottom up. And that's because there are it's kind of like a ladder in terms of the different sections of the brain that are developed. So the first section of the brain that develops first is the brainstem. So this is responsible for really primitive things. So basic sensory perception, motor skills, usually things that we do unconsciously that we don't really think about. So being able to see things, knowing something's in the room, just basic things like that, that's dictated by our brain, but it's pretty unconscious. It's something that we don't really have to be aware of or actively think about. The next section of the brain that develops is called the limbic portion. And this is largely responsible for things like attachment, emotional development, and emotional maturity. And finally, the last part of the brain that's developed is the cortical brain. So this is what's responsible for things like thinking, higher cognition, emotional regulation, logical thinking, things like that. This also involves a section of the brain called the prefrontal cortex, which most people tend to associate with things like logical reasoning and things like that. You might have also heard that this section of the brain isn't generally fully developed until individuals are around 25 years old. So this last region of the brain continues to develop over time. And so we can think about this brain development in relation to adverse childhood experiences and toxic stress and trauma. So just from introductions, I can tell that most people in here are from a public health background. So this is unlikely to be new information to anyone. But of course, there's a list of experiences that are commonly labeled as adverse childhood experiences. These are experiences that often bring about toxic stress. These are experiences that are generally at least somewhat traumatic for individuals. And so this includes experiencing physical or emotional or sexual abuse, being neglected, or living in a household where a family member or relative has mental illness, a substance use disorder, where your parents or caregivers separate, witnessing domestic violence, or experiencing the incarceration of a relative. And whenever youth undergo an adverse childhood experience or a really traumatic event, basically our body's natural response is to go into fight or flight. And we've adapted this fight or flight response really in order to survive dangerous situations. So you might think of an example where you're out in the woods and maybe we're hiking at Cherokee National Forest or the Great Smoky Mountains, and we run across a black bear. And instinctively, your heart's going to start beating. You're going to be on really high alert. You're ready to fight that bear, or you're ready to run out of there. So that's really beneficial when there's an imminent threat like a bear, but it's not so beneficial whenever we're constantly in that state of mind, and it's due to things such as these adverse childhood experiences. So whenever these adverse childhood experiences occur, sometimes young people's brains kind of get stuck in these first or second stages, the brainstem development or the limbic brain. And so it doesn't give their brain the freedom to be able to develop this cortical section. It can impair some of our higher thinking and learning and inhibitions. And so this can lead to worse academic performance, worse emotional regulation, and this can lead to things like being more likely to be justice involved, outcomes such as that. And importantly, there's a dose-dependent relationship between experiencing an adverse childhood experience and a host of negative outcomes. So these include experiencing a mental illness like anxiety, depression, or PTSD, contracting a sexually transmitted disease, even doing things such as getting cancer or diabetes, risky behaviors, all types of things. And these are kind of listed on the screen. But importantly, is that adverse childhood experiences are not kind of they're not viewed as a life sentence for youth. And there's ways that we can buffer against these effects. And one of the main ways that we can do is fostering resilience, which is basically really close to youth empowerment. It's the process by which youth gain control of their lives. So here we have listed on the screen the adolescence empowerment cycle. So first, a young person experiences a positive identity development Let's say they take a public speaking class and now they perceive themselves as being a strong public speaker. This motivates them to go participate in positive, meaningful activities like speaking up in their community, seeking out activities where they can use the skill of public speaking. By engaging in these experiences, they learn useful and relevant skills. And because they're improving, they end up receiving positive recognition, and this reinforces this identity development. And so it continues to be this positive cycle, and you can see how this can clearly be very empowering for young people. Another important thing that we should keep in mind is that this cycle can also work in a negative way. So let's say a young person develops an identity perception of themselves that's negative. Maybe they lack self-confidence. Maybe they think that they're unable to achieve something. So let's just say a young person decides that they're bad at a particular subject at school. They have this identity in their mind. This might lead them to do worse on tests and assignments in that class. It might lead them to opt out of important activities, so they don't learn useful and relevant skills. And in doing so, they don't receive positive recognition. They might actually be reprimanded. And this kind of reinforces this negative identity that they have for themselves. So this really highlights how important youth empowerment is. And it shows that a lot of development occurs in very cyclical ways. And so working with youth, a lot of times it's just a matter of getting the ball rolling. And a lot of times as youth workers, there's a tendency to look at young people and say, this is really overwhelming. There's no way I can do something or change the trajectory of this person's life. And this shows that once you just kind of get the ball rolling, it's a feedback loop, it's cyclical. And so once we start a young person on the path of developing a positive identity, it's kind of a reinforcing thing. It kind of just gets the ball rolling, and it allows them to be more empowered later in life. So here's just some other beneficial outcomes that's been associated with youth empowerment. So first, better academic achievement, better problem solving skills, improved critical thinking skills. This goes back to that piece about brain development in the cortical region of the brain. Better self-regulation. This also goes back to that piece about brain development. Increased self-confidence and self-acceptance. This relates to the previous slide about the feedback loop of youth empowerment. Increased personal responsibility. It helps prepare adolescents for adulthood. And it increases community connectedness and social relationships. And that's something that I think that we can all agree is crucial for just a meaningful and fulfilling life. So this slide just goes over some successful youth empowerment programs. So these are basically just key characteristics that we've been able to identify among research that's looked at youth empowerment programming. So first, successful empowerment programs tend to utilize active collaboration among youth. So youth aren't just sitting back, they're not being told what to do. Youth are playing a key role in the process of coming up with whatever activities that are happening. Additionally, successful youth empowerment programs tend to build upon participant strengths. So if a young person is particularly good at, let's say, art, then we might give that young person more activities and more projects related to creating art. And again, this can help reinforce that identity for this young person that they're good at art. It increases that confidence. And we give them activities relating to art. And so this increases their skill set relevant to that area, and the cycle repeats. Additionally, this is kind of related, they're individualized. So there's not a one size fits all approach. It's unique to each individual young person's strength or challenges. They're also inclusive, so we're not excluding any type of youth. We're being aware of unique needs. And finally, it increases participants' awareness of the world or the community. And so this is pretty similar. This goes over some empowerment strategies. So one important empowerment strategy is to incorporate social interactions among youth. Additionally is offering choices. This feeds into that piece about increasing youth's autonomy and sense of self-directedness. They tend to utilize discussions. This relates to the active collaboration piece. They use related and relevant information. They utilize positive reinforcement, and they utilize active listening. So I figured that I would stop here and I would just share some personal experiences of using some of these strategies and kind of just point out a real world application of how this works. So last summer, I helped to lead a participatory action curriculum for young people at a Boys and Girls Club in Cocke County. And so basically the only goals of the curriculum were to increase the young people's awareness and understanding of opioid use disorder. And then it was to challenge the youth to come up with a creative project that was totally directed by them that improved outcomes relating to opioid use disorder in the community. So the first part of the curriculum, basically what we did is we just talked to the youth about what opioid use disorder is and how it affects people. And we incorporated a lot of social interactions and group discussion because we asked the youth to reflect on, in their personal experience, how they've seen opioid use disorder affect Cocke County and affect Newport and kind of their surrounding community. And so they were able to talk about that. And through that, they were actually able to identify a significant challenge related to opioid use disorder, which was stigma in Cocke County. So the young people actually ended up deciding that stigma was a really big issue and that they wanted to work on that. So we talked through with them different ways that we could possibly change stigma in Cocke County. And so they actually ended up basically doing their own independent project where they had created flyers about stigma, and it was about language. So basically say certain things and not say this, not that. So for example, avoid stigmatizing language, like calling someone a junkie or something like that, and instead say, a person with opioid use disorder. And so we actually helped the youth create these flyers, and we sent them to medical practices and providers in the surrounding area. Another thing that we did is the youth decided they wanted to create a presentation about stigma. So they put together their own PowerPoint, and we invited local doctors, we invited the local government, so the Cocke County mayor and the Newport mayor, as well as some people from UT, and the youth were able to present about stigma. So as you can see, that this was just an example where, of course, we were relying on social interactions, we were relying on discussions. We offered choices to the youth. So when they identified that stigma was something that they wanted to work on, we told them, okay, well, here's a few things that you can do, and we let them pick. We utilized positive reinforcement. We celebrated them once they had finished the project. And of course, it was active listening. We were actively seeking out youth feedback and determining what they wanted to do. So really just wanted to go by these one by one. So the first one is talking about incorporate social interactions. So youth are very social, as we've all seen. Oftentimes they seek out approval from their peers and support from their peers. And group work and activities are very important. So I wanted just to get some group examples of this. If anyone has a particular experience of working with youth and incorporating social interactions, if there's anything that's worked, if there's anything that didn't work. You can also talk about some of the challenges related to COVID and doing things online and if anything worked. I'm just interested in hearing from you all. And with this, feel free to either just unmute yourselves and talk, or you can just send something in the chat.
Could you repeat the question, please?
Yeah, I was just asking if anyone had any personal experiences of incorporating social interactions into youth programming, and if there's any strategies that have been particularly beneficial or have particularly worked, or any that haven't. I was just interested in kind of hearing about some experiences related to this.
Hey, Kyler.
Yeah.
One of the things in which I found to be really cool is incentives, and you spoke on it earlier. I remember when I would work with youth, we used to incentivize certain activities, to kind of get them to want to get engaged. A good example would be if we needed someone to, to serve as an intern, or, to provide some community service, that would be an opportunity for them to use those hours as it relate to their courses in which they're studying. I know that actually benefited me. When I was an intern, I was able to use some community service hours, and that also helped me, to want to be more engaged and more involved. Gaining those hours, which I could apply towards graduation. So incentives always work really well.
Yeah, that's actually a really, really good point. Is that just establishing the right incentives are important for really any type of successful youth programming. One thing that I also wanted to mention is that incentives look different for different age groups. So as you mentioned, the community service and things like that, I can imagine that being a particularly big incentive for maybe high school students or even college students, along with the internship. Is that students kind of in that age range, high school or beyond, tend to be thinking more about career or academics, or long-term goals and incentives relating to that. Whereas, if we're working with a younger audience, incentives might look a little bit different, right? So they might be a little bit more immediate, not necessarily relating to their long-term goals. But that's definitely a great point, establishing the right incentives for social interactions. I think that was also especially relevant with COVID, because I know that it has been especially difficult to draw people out to be engaged when it's an online setting, like in Zoom or something like that. So setting up the right incentives is really important. And let's say we have a comment in the chat from Sanasha. Says we are currently working with our Boys and Girls Club on a community garden at their facility. They were able to paint and design the tires we recycled as a group. I felt this process gave them buy-in to the process and time to socialize with each other outside of what is typically a classroom setting. Yeah, so I think that's awesome. The community garden is certainly an example of when youth are able to take control of their community and lead a project that's self-directed. and certainly a time when they can socialize outside of the classroom setting. All right.
I have an example as well.
Mhm.
It's something that we're just now starting, but we're partnering with juvenile court to do a restorative community service program where with their youth offenders, where we are going to connect the youth with organizations in the Carter County community to work together, instead of like typical mandated, like pick up trash on the side of the road. They're actually like having conversations with people in our community as they work together on a project and that kind of thing.
Right, that sounds like an awesome project. And I think that also relates to like what Horace was saying with incentives. So a lot of times we'll think about, youth volunteer activities as, just an example I can think of for when I was growing up was I would get told by someone to go out and, help clean up a highway or something like that. And the only real incentive there is maybe the volunteer hours. But like what you're mentioning is that the youth are actively talking to people in the community. They're establishing those relationships. And once you have an emotional or a personal connection with someone, that seems to be a key incentive to get involved and facilitate those social interactions. So the second one that I wanted to talk about is offering choices. So choices facilitate autonomy in adolescence. A key example of this is with advocacy and organizing. But also we need to keep in mind that the choices need to be reasonable and limited. And there's this phrase called freedom with parameters. So obviously we can't let people do anything and everything, but we can give them a limited range of reasonable choices. And what I found works is just simply explaining to youth why certain choices aren't feasible or why we can't do them, just from basically a logical or practical basis. And so this usually allows them, to understand why there's a limit in choices. So I also wanted to see if there's any group examples with this. You can post it in the chat or unmute. I'll go ahead and talk about my personal experience. So last summer, as I mentioned, I was working with youth at a Boys and Girls Club in Cobb County, and they all basically decided that they really wanted to reduce stigma in Cobb County. And so there were lots of different ideas about how we could go about this. The youth said, maybe we can get a big article or meet the president or things like that. And so you have to talk to them about being realistic and practical and which strategies would actually be effective at reducing stigma. And so we basically presented it as we were just brainstorming with them. But in that brainstorming process, we were throwing out examples of what they could realistically and practically do to reduce stigma. And so in that we were offering choices. We weren't explicitly limiting their options, but we were offering them choices of what they could do. So if there's any examples, I'd love to hear them or just any thoughts about this, of how you've gone about offering choices to young people. So yeah. And it's totally fine if there's no comments. I know these are kind of difficult questions to think through and think of a personal example. Oh yeah, Horace, were you saying something?
Yeah, I just want to give another example. Yeah, so one of the another example that came to mind is that it was brought to our attention that one of our coalitions, they had a youth group, and this youth group noticed that there were a bunch of cigarette butts, outside at the square, the county square. And so this was kind of before, this was right around the time when, preemption was at its height, but they wanted to figure out a way to ban smoking, in that particular area. So as you mentioned, they had to, talk to them and explain to them that because of law, there were certain things that they could do and certain things that they couldn't. So what they decided was they came up with a unique idea to create posters. And they presented these posters at one of the county meetings. And, the county officials thought that it was a good idea to post these posters out, in the public square, and from there they were able to display the no smoking posters. And, it was a big hit, and so it was still within the law, but at the same time, they were able to, voice their opinions on what they thought about smoking in the public square.
Right. That's an awesome example. That's like a perfect example of youth empowerment where, there was a clearly identified need or issue in the community, and they had choices offered to them, and they were able to be supported in their process of changing that issue, and they were successful. So which age groups was it? Was it?
It was middle school kids.
Okay, wow. Huh. What were some of the reactions after the meeting and after the poster was presented?
Well, it was interesting because, it's funny how adults, listen to young people versus other adults, we
Right.
find it a lot of times. And so they were just really impressed, with these young people taking upon themselves to come out and, make these posters. They recognized that there was a need, they described to them in such a way to where it was presented to where it was a win-win. We're not stepping on anyone's toes, but, these cigarette butts out here, they are a huge eyesore, And so from there, they were able to convince them that we can't change the law, but it won't hurt to, place the posters out where people can see them, and, people respected the posters.
Right. Right. And that's also, that definitely took something on your part to be able to listen to youth, and you heard an issue and you were like, okay, well, we can actually change this. It doesn't have to be this way, and you can take this in your own hands. So thank you for sharing that. That's really cool to hear about.
Yeah, no problem.
So I see that we're running a little bit short on time, so I'm just gonna kind of go through these last couple of tactics, and then finally I want to leave some room for discussion and talk about some concrete ways that we can implement these. So number 3 is discussion. So you can clearly see how this relates to youth empowerment. It's a collaborative process by which youth are able to talk to each other. They're able to work through challenges out loud. We want to clarify guidelines. So telling youth that there's no, necessarily right or wrong answer. This might make them more willing to be able to speak up. As an adult, we don't want to take the lead in the discussion. We want to facilitate discussion. We don't want to offer comments or express judgment until all ideas are shared, because sometimes this can make youth more hesitant to speak up. And also just allow for enough time, because sometimes it takes people a while to think and to gather their thoughts and to decide what they want to say. So I'm sure that we can all imagine a situation where there's been a discussion and then we're driving home and then we think of something, oh darn, I should have said that. That would have been a really great comment. Finally, relevant and related information. So whenever we're doing youth empowerment, we want to emphasize real and meaningful contributions. So ideally, these are affecting issues that the youth care about, that they're passionate about, and that affect their community. We want them to be culturally aware and, of course, applicable to the participants' lives. If we decide to come up with some type of project where youth are going to work on some issue that maybe is abstract, or maybe it's affecting another community, or it's on a national scale. It's pretty intuitive how we can understand how that's not necessarily youth empowerment. That's basically just telling youth something to do that they're not necessarily very interested or passionate about. Finally, or not finally, but almost, is positive reinforcement. So whenever young people are expressing their ideas, even if they might not be entirely correct, or maybe if they have ideas of something to do that's not practical, we want to still praise young people for bringing up these issues, for taking charge, because we don't want to set any barriers for future participation. So specific positive attention, saying things like, that's a great idea, or I really appreciate you saying that, I appreciate your hard work. Basically just recognizing people. This goes a long way with youth. And finally is active listening. So here's just some important things to keep in mind, having good eye contact. Paraphrasing can be especially important. So sometimes when youth are talking to you, as we all know, their words can get jumbled, or they have a hard time expressing what they want to say. So it can be helpful to listen to them and then say, okay, so what you're saying is this, and paraphrase. Asking them open-ended questions, expressing empathy, watching nonverbal cues. So we don't want to have our arms crossed or anything like that, and avoiding judgment and avoiding immediately giving advice. And so this is probably one of the most important strategies for youth empowerment, is just to be really in tune with what youth are saying. You might hear young people complaining about something, and an instinctive response might be to, be grateful, don't complain. But we can also maybe listen to them complain and use that as an opportunity to help them to identify an issue or something that maybe they can change and that they can improve in their community. And then just here's a few phrases, some active listening starters. So saying, paraphrasing, saying, it sounds like you mean this, or maybe you're feeling this, or helping them clarify what they're saying. So could it be that you're saying this? So finally, I just want to go over some implementation strategies. I know I'm running a little bit short on time, so I'm going to kind of make this brief, and then we can have some discussion at the end. So basically, just to summarize, this training is we want fewer handouts and more creative outlets for students, more movement, youth talking more, listening to us less, and also importantly is making it really culturally relevant and related to issues that are directly affecting young people. Here's some other ideas to implement. So active engagement, artistic expression, brainstorming, just some very concrete ways that, some different empowerment projects might involve taking photographs, maybe community service projects, incorporating time for informal interactions, use of technology, poetry or writing, utilizing music. There's also this interesting point about youth slang. So you might notice that if you're working with youth, there's like, certain lingo that you might feel disconnected from. And some educators might try to incorporate this into their language to kind of increase parity or be on the same level as young people. But sometimes this can kind of come across the opposite way, and it can be almost like disrespectful or funny if you're just like saying things that you wouldn't normally say. So I would just say a rule of thumb is if you're not saying it outside of this setting, then probably shouldn't incorporate it. Age appropriate leadership roles. A concrete example is creating a youth council for working on certain issues. And so before we want to do just the evaluation, I've got a short link for a survey. I just wanted to ask if there's any discussion about, have you seen any of these strategies play out in the roles that you've had with youth? Or also, do you have any questions? Are there any challenges that you want to talk through when it comes to youth empowerment? So, yeah.
There was an awful lot in there that I don't think applies to just youth. I think they apply to everyone, and that we should all be trying to incorporate these ideas in a lot of our activities. And then in particular, the words that you use around youth. I think that every smaller community has their own kind of language, and it's not always the right choice to use the language that they use among themselves outside of that group. So.
Right. Yeah. I mean, I certainly agree. Yeah. And I mean, in terms of like the language piece, it can sometimes, come across as like taking something that's not yours. If youth are using, a set of language that's oftentimes a way to develop a particular identity. And so it can sometimes be like kind of offensive, I guess, to start using, words that just young people use. And while we're doing the discussion, I'm going to copy the evaluation link and just put it in the chat. And so that's just a way for you to give feedback on the training and any things that we can improve on, or any things that you would have liked to have heard. But as people are filling that out, yeah, I want to continue to hear about any questions that people have, or any comments, or anything you'd like to add to the presentation. I know we have a lot of expertise in the room in terms of working in public health and working with youth. So I'm definitely interested in hearing from you all. Thank you, Horace.
I have a question. So you mentioned a curriculum. Is that going to be something that's going to be available or to other organizations, or what?
So the curriculum I mentioned was in relation to a specific program that I'd implemented last summer. So it was specifically around opioid use disorder in East Tennessee. I think that curriculum might be available online if that's what you're specifically asking about. Was that your question?
Yeah, I'm wondering about that.
Yeah, I actually think that might be available on the RCORF website. Let me see if I can pull that up and drop that link into the chat. And if not, you could actually, you could probably email me and I would be happy to send it along. Let's see, give me just a second. My cursor on my computer, my mouse is like, so I don't know what's happening to it today, but it's really like slow. I'll check if it's on that website. If not, this is my email, and I'm happy to talk more if people want, or send along any resources.
While y'all are finishing up that survey, I'm going to put the link. I know that this is always confusing, but we do have to complete 2 surveys for these meetings. One survey for Kyler to kind of share with him how he's doing, and then also the additional survey for Tatis, who's providing our training today. So please make sure you do complete 2 surveys for this training today. So again, Kyler's is in the chat, and then this one that I'm putting in the chat, you'll have to print and send back to me or fill out and send back to me however you want to. So I'm going to send this second one, put it in the chat now. And please make sure you complete both of them. Anything else for Kyler before we move on? All right, thank you so much for being here. We appreciate you.
All right, thank y'all so much. I enjoyed the training as well as getting to hear about some of the awesome work that y'all do. So thank you.
Thank you. All right, so we are going to now switch into our 10-pack report with Christy Smith. So this is, again, I'm going to share the agenda for you in the chat. You can follow along. She typed up most of her notes for us already. So y'all are welcome to follow along there, and I'll turn it over to Christy.
Okay. I'm sure, I know Horace was there, and I think Katie might have been there. Trish might have been there. Trying to think of who else might have been there for the 10-pack meeting. So there were several people who talked at the meeting, and of course, Kate Faulkner with the TSPN, she talked for suicide prevention. And so she said they are having some fentanyl trainings going on in May and June. So if you're interested in that, just most of you probably have her email address. And of course, our TSPN person is Ashley, I want to say Sharp. Is that correct? In Northeast region. She's a great go-getter, and I know Molly Colley was a great TSPN representative for Northeast Tennessee, but Ashley is really good as well. So if you need any trainings in suicide prevention, please contact her. But Kate as well, you know, she's I want to say she's more Middle Tennessee, is that right, Horace? Yeah. So, but she did share a Dropbox folder with all the documents for coalitions so they can use them. And I know I put it in that document that I sent to Jillian. So maybe she'll share that with you all for the fentanyl resources. Okay. And so Lacey Hartigan with EMT, she's the one, of course, that does our Tennessee Together survey. And that time is coming up again, everyone. So if you need help in regards to talking with your, you know, superintendent of your schools or any of your schools, she'll be more than welcome to help you. You know, the National Guard can help come up and minister it if you need be. Now, you know, in Unicoin County, thank goodness I have a great relationship with my school board. And so it is so easy for me to get those surveys for the 8th, 10th, and 12th grade. I know some of you, it can be quite difficult. You know, we're a smaller county. Some of you, like Washington and Sullivan, is much bigger county. So it's kind of sometimes hard to get those getting taken care of. So, but she said it is time, and they did, of course, change and add. I want to say change. They edited and they added some questions. I know in the past at a 10-pack, I might have asked her something about marijuana, more marijuana questions, especially when it came to access for our youth. And so I'm pretty sure they added those, some of those type questions in. She did say that, what else? It's going to be, I think she said maybe 1 or 2 questions more. It's not going to be like, you know, at one time when we had student surveys, there were close to 70-something questions on those things, you know. Now they've dropped it down tremendously, which is, to me, more effective. So, also, Hannah Carlton, who works with the EMT with Lacey, she did report that the tnprevent.org website is going live here soon. It's live now, but they're still working on updating it for trainings, and she gave us a little sneak preview of it. So you all know as much as I do as prevention specialists, if you're not going to PTTS or you're not going through CACA or SAMHSA, and some of those that, or PTTC, excuse me, or some of those other informative networks that give us trainings and CEUs, the tnprevent.org website will be up soon and be ready to go. So just look out for that. If you want to go online, you can probably look at it now, and they've changed, makes it easy to maneuver around through that website now than it did before. So the Tennessee Department of Health, Megan Sales actually reported out because Miss Liz Johnson was unable to attend, and she's part of the new tobacco team, and they talked about the May campaigns and the youth cessation classes that are going on from May the 16th through the 20th, which of course today's the 23rd. They had a nicotine replacement check out at the CDC website. And then June the 5th through the 7th is the Tennessee Strong Youth Summit in Chattanooga. And as of, well, that day that we had the 19th or 17th that we had the NEPAC meeting, 350 people had already registered for the TN Summit in Chattanooga. So presentations would be included were like Tobacco Free Kids, Smoke Free Tennessee. I know John Rust was going to do a presentation as well, but the registration for it closed on May the 15th. I know that sometimes Jillian takes her youth and has in the past to that. I'm not for sure she's doing that this year or not, but May 15th was also No Menthol Sunday. And then May the 31st, which is next Tuesday, is World Tobacco Day. So it's kind of helping get people to quit tobacco that day on the 31st. So I know some organizations are, some coalitions have helped. Well, you know, the Tobacco Free Sports campaign that goes on, getting your baseball teams or basketball teams, anybody like that, to get their athletes involved in pledging to be tobacco free. So I know, like with, I think it was Putnam that showed us some banners that they had printed up or with their athletes, right? So I know several in the community, I think up here might have done that at one time, but anyhow, Chasco, the 17th and 18th of May was the PIP conference. So Casey Matthews had mentioned that 175 people had already registered for it, which is one of the it is the largest registration that they've had. And I don't know, I was there. I think there was a lot of great informative sessions this PIP conference. And I know Alice and a bunch of others that were there, and I hope next year it'll be back in person again. I don't mind either way, you know, I don't mind the hybrid, and I don't mind going down toward Middle Tennessee either, but it was a really great conference for those who did attend. Chad Johnson is, of course, talked about the PIP well, he didn't mention much about the PIP conference, but I will say this is the year this is 2022, right? So everyone, if you remember, but August the 31st is the time to get our CPS certificates once again. So I know I have been getting alerts from the TCB in regards to the certification board. And so if I was you all, I would start uploading your certificates as soon as you can. That way you're not scrambling one whole day to get everything, you know, into the computer and uploaded to the TCB board website. Okay. Just to give you a little heads up. So, but anyhow, the National Guard, they're offering the SAPS conference. No, wait, they're offering the SAPS course training coming up in late September. So look for that. I'm sure that when we have our state meeting in August, that they'll be speaking about that. Also, they're going to be offering a life skills class. And then, of course, stash away vehicle if you're wanting to get that booked, book it as soon as you can, because I'm sure, they're so busy with that. I had to cancel it back in March. But I had to cancel it. And the reason why is because their budget is tight right now too, right? So the sad thing is that, and plus with the high rise of gas right now too, guys, you got to think of that as well. But who is anyone on here? Let me ask first, does anyone on here have that scheduled for any of their events in Northeast Tennessee? No? Okay.
Melanie's been trying, but she hasn't been able to hear back anything.
Okay. Well, I know they're on a tight schedule too. So if anybody is interested in scheduling that, please let all of us other coalitions know in a group email. That way we can do it, and get them back to back, even if it's just 2 locations. That way that we can, central locations. That way we can get others and parents and stuff to come to that. Okay. Also, Kathy Galapa, of course, with TDEC, they have secured 15 boxes, more new boxes from the state, and there are 7 of them that are still available. Right now, 8 are secured, and they are waiting for the labels from the DEA to put on those before they send them out into the communities. I know Unicoin County I got one more for the town of Unicoin's police department. So I don't know if any of you all needed another permanent lockbox. So, and then of course, Tatus, Maria Smith, we do of course have the June the 7th ethics and prevention training coming up with Bill Gibson. And then Maria said also there's a lot of upcoming training. So look on their website, get, sign up for their email newsletter, because it does show a lot of trainings that are coming up. And then also, I received an email from Tatus here the other day in regards to membership. So if your coalitions, want to become a member of it, just contact Maria or look at their website for registration for being a member. So, of course, we had regional updates, and we did touch on Region 4, Region 3 North, Region 6 South. I think there was like 3 different ones, and I love it, Xavier. I know everybody knows Xavier. That man just melts my heart. But anyway, he had, with their coalitions in the past, they never did what we have been doing for, I don't know how many years now. We do, well, since COVID, of course, we haven't, but, normally every quarter when we have our NEPAC meeting, we go to different counties, right? And so they've started that down there in Region 6, which is Lauderdale. Does that include Memphis? No, it doesn't include Memphis, does it? Weekly, it includes all those on the west end, doesn't it, Horace? Yeah, we're on this far end, they're on that far end. So, but some of the coalitions talked about their drug take back and the numbers that they had, the prom promise stuff, PSA contest. And so I always enjoy listening to what others are doing. Other coalitions are doing across the state. I know some of us probably have been doing the same things that they have, but it is nice to know that we think on the same wavelength sometimes. So, but anyhow, I think that's about it. Do you have anything, Horace, you want to add?
Nice job, Christy. You
Thank
covered
you.
it all.
Thanks. Okay, I think that's it, Miss Jillian.
Thank you, Fran. All right, so we'll go into our member updates. So everybody is welcome to share what's going on with you and anything y'all want the rest of us to know about. So whoever wants to go first.
I can go ahead and go first since I am the first on the list. So things that we have been up to, we've been working with the schools a lot, Washington County schools. We have been working with their school resource officers. So now all of their school resource officers have lock boxes to give to any parents that are in need, so they don't have to either come to our office or anywhere like that. It's right there at the school. So if they're closer to a school, they can get a lockbox that way. I've been working with Becky McKinney at the health department to get in-depth up and rolling in the school system for the fall. We've been talking with them. We're thinking about doing Saturday classes for any individuals on their second offense. They will have to attend the Saturday class. And they were speaking about on the third offense, getting parents involved, with the parents having to do some type of education with the kids as well, if they get caught once again after the in-depth program. Earlier this month, we did do a panel discussion on substance misuse with Johnson City Schools. That was a really great event. I was on the panel with one of their school resource officers, their supervisor of safety and mental health, as well as a few individuals from NISWANGR. So that was a really good event for people to ask questions and get more information on substance misuse and on fentanyl that's going around in our communities. So overall, that was a good event. For the summer, we will be partnering with Coalition for Kids. We're going to be doing some youth education with them on Thursdays throughout June and July. So I am really excited about that. We also did do our drug take back. We were in 3 locations this go around, which was really exciting, and that was pretty successful for us. I would say that is the bulk of what's going on with us right now. I know Tracy's on the call. I don't know if she has anything to add. We also have been partnering with the adult day services. So we are working with them of getting them resource packets, as well as trying to get lock boxes in the hands of those more elderly that may need them. So we have resource packets that are going out to them, and if they bring the resource packet back and say that they're in need of a lockbox, we can arrange to get that sent to the Adult Day Services Center so they can get it right there. But other than that, I think that is all.
I can go next. This is Melanie. Let's see, we have partnered with the health department, the Sullivan County Health Department, United Way, and some other folks to create a pamphlet for to send out through the schools for parents, so asking them to make healthy choices, and hopefully we'll get all that ready to go by the time school starts again. That'll be a back to school pamphlet, and we're partnering this summer with the YMCA, and Boy Scouts are going to have us come talk about drugs and alcohol prevention. Let's see, we did have the take back. We had 471 pounds collected at the 3 different locations. So it was a nice sunny day, thank goodness. And what else? Alice, I did get a email back from Empathy from the National Guard just this morning, saying that she just got my email, and don't know why she didn't see about the stashed away truck. And I was asking them to come in July for Fun Fest. It's a 2-day event that does get quite a bit of kids and parents, but they're not able to do that date. They've got some training or something. So, but if anybody other coalitions do end up having something that they're going to come to, we'll see if we can make a different event around that. I don't know what else. Needed a list. So that's all I've got right now.
Melanie also did fentanyl awareness for the Tennessee high school students over 2 days, half of the school one day, half of them the other based on the fentanyl PowerPoint that the department sent out. And then some of the work that she and I have done in collaboration with other organizations. Frontier Health took the lead on doing a fentanyl awareness in the Kingsport schools. In terms of our prevention stuff, other than we're in hiring mode again, we're expecting a new DFC coordinator to start on June 1st, and I am really thrilled with this person. And then we're still looking to replace our marijuana and stimulant person. That the guy that was in that role took another role for the CDC, working with us in another capacity. So taking me a while to figure out what end dates and how long the monies last, but I know we have some spending to do there. And that's our, I did want to, for harm reduction, I'm going to skip over our intervention stuff, but we've been also doing a lot of work around International Overdose Awareness Day. Our media campaign is ready to go. So if you guys need stuff, that is a regional campaign. So if you have some stuff that you need there, please let us know. We're also trying to figure out who is doing what, where, and when during that week. And we'll try to keep that posted for everybody too. So let us know if you've got International Overdose Awareness activities.
Hey, this is Trish. I'll go ahead and go next. We just did a 9,200 piece mail out. That was a county-wide mail out to every household in the county, letting them know where the lockbox locations were, and also our drug take back day. We did collect 77 pounds for our drug take back day over the 3 locations, which was really, really good for our small county. I believe that was one of the largest take backs that we've had, one of the largest collections that we've been able to get. In June, we are doing our annual town hall event, the 21st of June here in Johnson County. And with this being an election year, one of the things that we have decided to do is allow all of the candidates to come in, and we have a specific question that we are allowing them to answer. It is a huge election this year. We've got 30 or 40 some people running for the different positions, and the mayor and the sheriff are 2 that are very vital to what we do. So we are giving them 5 minutes to speak about how they feel from their position they can work to reduce substance use disorder in Johnson County. So we're giving each of them 5 minutes to do that, and that's going to be a really big event for us in June. And one kind of odd thing that we were asked to do that I never would have thought of, but I'll mention it to you guys, and it's probably nothing that would work for you all, but we were asked by the Sheriff's Department to do an naloxone training for the local sanitation department, that the place where they dump trash and where they dump all their trash is actually located behind our state prison. And they have found that people are coming in from outside our county and leaving drugs at the sanitation place, they're leaving them at the dump, because the inmates come over there and dump the trash, and they're picking up their drugs at the dump. People are leaving them for them. So it was an odd thing to do, but we were asked to do a naloxone training for them at the dump site where people dump their trash. So that was kind of an interesting thing that we were asked to do. So that's just a few of the things that we've been doing in the last couple of months.
I guess I'll go, unless Horace, do you need any updates?
From you?
From y'all?
Oh, from us. Okay, yeah.
Go ahead.
Yes. So we just want to remind everyone that, as we get close to concluding this year, FY22, you'll probably be hearing more from us on spending. Please let us know if you're not going to be able to spend all of your funds. Let us know if you're going to have some, monies left over remaining from your different budgets. Please just let us know, and it's not don't worry about it. It's not going to affect your funding for the next fiscal year. We just have to make sure, moving forward into the next fiscal year, that we take care of all of the funds as it relates to FY22. Also, too, hopefully everyone responded to the questionnaire that we sent out concerning the statewide coalition meeting that we're going to have. I think we wanted some feedback from you guys as it related to in-person, virtual, or a combination of both. So hopefully everyone was able to respond to the form stack quarterly report calls. We know how much you guys love those quarterly report calls, and we love them too. So, we're in the process of going through those. We really appreciate all of the feedback that you guys provide us on those calls. And if we hadn't got around to you with setting up, your third quarter quarterly report call, just hold on. We're making our rounds. All right. Also, too, just friendly reminder, with your 10 wits entries, please continue to put in those 10 wits entries. We ask that you guys do those bi-weekly. All right. And we also would like to say thank you for all of the patience and understanding that you guys have had with us along the way as we get adjusted to this new system, in 10 wits. I know we've had a lot of quirks. We're still trying to iron out a lot of the wrinkles as it relates to 10 wits. So please continue to be patient with us. And if you have any questions on anything, just please contact anybody on the team and we'll be able to help you out. Again, great job, Christy, of updating everyone on the new tnprevent.org training website. Please go on there, register. I did it. I went on there and I registered. Trust me, it'll probably take maybe about 2 minutes, but it's a lot of great information there. And, we're excited about it. We want you guys to really take advantage of this opportunity. And also, too, we are in the process of reviewing the announcement of funding proposals. We really appreciate you guys working with your neighboring sister coalitions that we do not have a contract with. And, we're excited about this opportunity to be able to, expand and the possibility of add new coalitions to the family. We really appreciate the work that you guys have been doing as it relates to mentoring, the coalitions that we do not have a contract with. So we're really excited about that. You guys owe yourselves a pat on the back for the help that you guys have provided with us, in this process. You guys deserve a medal. We really appreciate it. So that is all that I have. If you have any questions on anything, you know how to get in touch with us. Please continue to keep up the good works that you guys do. We really appreciate it.
Horace, how many new coalitions are going to be able to be funded this go round?
Well, we really don't have an answer. I can tell you though, last year, not last year, we were, the last go around, we were only expecting to, I think, fund maybe 3, and we ended up, being able to fund 5, so that kind of gives you kind of a feel of, we may have our mindset on maybe, 4 or 5, but who knows? We may be able to do a little bit more than that, so we're just excited about this opportunity.
Thank you.
Hey, Horace, when do you think we'll have a date for the statewide training in August?
We're working on it now, and we should have a date, Jillian, next month to you guys. Should be next month.
Thank you. Anything else for Horace? All right, Christy, it's you and me. You want to go first?
I'll go. I will say that we had participated in the Prom Promise at Unicoin County, and also Mental Health Awareness Month. We did some things at the middle school, and then our biggest week was the Alcohol, Drug, and Facts Week. Oh my goodness, those kiddos were all about it. We handed out a lot of information. Those kids actually just come right up to the table and want to know more about vaping, because that's a huge part of what's going on in our middle school. Actually, too, that goes to the focus groups that we're doing every 9 weeks in the middle school, starting again once school starts, and it'll go 6th grade, 7th, and then 8th graders. And these kids are so ready to start a coalition at the middle school level. And I'm so excited because that's going to help get those kiddos, to become leaders, ambassadors, and take them to the 10 Institute, the Teen Institute and all that good stuff. So we're excited about that. Our in-depth program, Sandra actually has been working with the high school on it, and she had, I think around 5 students this past time. So these are students who are second offenders. Right now, the high school is going through Frontier Health to educate the students, but Sandra even heard from some of them that education class is awful. So with Sandra, with the in-depth, it's been more interactive. She's kind of switched it up a little bit with that program. And so they're actually listening, she said, and asking questions, which makes it even better. So we are working on right now with UT Extension to have a grandparent support group, caregiver support group is what we're going to talk about here, because 80% of our juvenile court kids are living with their grandparents or even their great grandparents. And so UT Extension has a great program in Washington County right now. And so we'll be starting it in July in Unicoin County. And I already know there's a lot of grandparents that are ready for it too and interested in it. So also, one thing that we're working on too is Second Harvest Food Bank is going to partner with us to put a pantry in our middle school and high school through our DFC grant, the mentor program that we have. We're seeing a lot of those kids that are several of them are in need of food. So they're actually going to start putting a pantry at the high school and middle school both, which is great. That's already starting to occur. So our SOAR grant, we did actually add like 4 new businesses to it. I just got a huge lockbox order. Oh my goodness. And which I'm thankful and happy for. So we did put a veterinarian in there too, and she took like 24 of them, so to hand out to her clients. So anyhow, and then also I think Walmart. I don't know if I touched up on this really quick, but we are working with our Walmart because they have a program that provides, if you need volunteers, they will send their volunteers to your event wherever you're happening, because we're going to be at the farmers market this year. We're working with UT Extension on 4-H and the YMCA after school stuff during the summer. They will come out there and help you, and if they get so many hours within a quarter, the most you can get is $5,000 every quarter from them donation. So that means as a coalition, you can earn up to $20,000 a year without doing hardly anything. Like they're coming over on Thursday and helping us stuff our lock boxes to hand out to our community. So that's hours. That's going to take a bit a day, right? So that's hours right there that can utilize the Walmart employees. And they loved it. They helped during the prom promise. They loved it. They had a great time. So any events that you have, get with your local Walmart. Thank goodness Sandra knew our manager at our Walmart. They were good friends in high school. So having her it helped tremendously, because Amy's a go-getter and she's ready to get employees out there to help us. So yeah, that's all I need. That's all I wanted to say.
All right, thanks, Christy. All right, so in Carter County, we've got all kinds of stuff going on. Summer's always our busiest time. We had a meeting a couple months ago with all of the school resource officers, talked to them a little bit about our vaping programs. We went to virtual programming during COVID and kind of wanted to check in with them about that and how it was going, and they wanted us to start going back to in-person programming. So we just started Elizabethton High School after school in-depth programs, and we actually were able to rewrite their policy for next school year. So next year in their handbook, the first offense, they will do 4 sessions of in-depth. Second offense, they'll do the 8 sessions of not. And then the third offense is when they'll be referred to juvenile court. So we're really excited about that. We got to do a little bit here at the end of school, but excited to roll it out next year. We're going to do a big media campaign with that, make sure kids know, parents know, everybody's on board with it. So we've been doing that. Youth Coalition is still super active. We've got, I think, 25 or so kids going to Tea and Strong this summer. My favorite conference every year. Love Tea and Strong. So we're really excited to take them to do that. We also have one of our Youth Coalition members that's a Tea and Strong ambassador. So she is helping plan the event and all of that. We've also got a crew going to TTI. And then we also have a student in our Youth Coalition that is a national SAD leader. And so she is going to the National SAD Conference in July and taking a few of our youth with her to that. So we're super excited for all of the training this summer. Our drug takebacks were successful. Nash did an amazing job this year at organizing 3 different locations for drop off, one of which was the Boys and Girls Club. So that was a really big success for us and great opportunity for parents to come somewhere that they're comfortable and drop off drugs. Nash also continues to do classes at our Boys and Girls Club every week, and actually Nicole too. Nicole just wrapped up Prom Promise, the first time we've done a big community-wide event for Prom Promise. So got that. We did that this year for the first time. T has been working hard on getting lock boxes into recovery houses, making sure folks kind of on that end have lock boxes. So she's given out like 80 lock boxes or something in the last month or so. So lots of lock boxes going out that way. Brooke just did an awesome event on Saturday for mental health awareness. So if y'all have seen Encanto, it's like the best movie that there is, just saying. We did an Encanto focused event at the library on Saturday, and Brooke just did a really great job of kind of talking about different coping skills. That movie has a really cool kind of mental health focus to it. So everybody went home with a toolbox full of coping skills, different things they could use, Play-Doh and bubbles and lots of different things there. So that was super fun. She's also doing Celebrating Families right now, which is a parenting program that we do. So I think that's pretty much it for us right now. Anybody else that's on want to share a little bit about what you've got going on before we wrap up?
Jillian, I'd like to say something just for a second about the Community Resource Center. So we are part of Tennessee Department of Correction. We are located at 204 Freckles Court, which is off of the Bristol Highway. You turn down by Chaparral. It's on Wayfield Drive. Go to the very end and turn left. We're right across the parking lot from the Johnson City Probation and Parole Office. And what we do is we offer resources to anyone that is justice justice involved. That can be that they're currently on probation or parole through the state. It can be misdemeanor. It can be anything. If they're just looking for a resource, we have a lot of different resources available. We do classes. Everything is free of charge. If they are on probation or parole currently, supervised through TDOC, we can provide transportation for those classes. But we do an anger management class that sometimes people are court ordered. We do parenting classes, adult education, motivation. We have a Reconnect Reentry Navigator that helps them further their education. So we've got lots and lots of resources that the community may not be aware of, the offenders may not be aware of, but anybody is eligible. And we would just love to have any referrals, or if you have any questions, I could put my name and contact information in the chat box.
Please do, Shannon, because even today, you know, I had someone call me, and I'm going to go back and she's talking about referrals and stuff like that. I don't know if any of you all are using Unitas platform for referrals or anything like that, but it is free, and it's through, I'm pretty sure I'm getting ready to start using it, because I have a lot of people coming in off the street, you know, stopping by my office that need somewhere to go for whatever resource they need. And so, yeah, it'd be great if some of the coalitions maybe want to even get onto the Unitas platform. So.
All right, anybody else have anything they want to share?
Hey Jillian, it's Nash. I just wanted to share that in the chat, I put up the invitation to the luncheon to introduce Carter Compassion Center to everyone. It's going to be next month on June the 6th from 11 to 12 at their new center. They just want to make sure everybody knows that they're not trying to replace any existing organizations. They're trying to bridge the gap between people who are trying to find resources and actually getting straight to those, instead of being confused and not knowing where to go maybe, or somebody getting lost in the process.
Thank you, Nash. So yeah, if y'all don't know what the Carter Compassion Center is, they're definitely going to need resources from outside Carter County, because they're hoping to kind of be like a primary stop that people make when they need anything. And then instead of them having to search for different resources throughout the community, kind of everybody goes there and they send them all the different places. So obviously we don't have everything in Carter County, and they're definitely going to need some support from outside agencies. So thanks for sharing that, Nash. Anything else?
Update.
Yeah.
I'm Rachel Dean. I know some of you that are on here and have worked with you many times, but I'm the new county director and FCS agent at UT Extension in Carter County. So really looking forward to getting to know the organizations that are here in Carter County. And I know we definitely want to get the grandparents program started back up, like you were mentioning, the one in Unicoin, and definitely would love to work with the coalition too. So I've been here since the 1st of May, so still kind of getting my feet wet and getting to know people, but I'm very excited.
Thanks, Rachel. Anybody else have anything? All right, so I did the best I could at taking notes about all of your amazingness that y'all are doing. But as always, please feel free to update it with things that I may have missed. So I'm gonna put the agenda in the chat one more time so that y'all have it and can update anything you want to before it's finalized and sent out to everybody. Feel free to do that. Again, make sure that you submit 2 evaluations for the training. I added both links to the agenda as well. So you have the one that Kyler shared and then also the one for Tatus. As soon as I get your evaluation for Tatus, I will email you your certificate right back. So y'all will have that to add to your trainings. We won't have another meeting again for a while because we'll all be together in August for the statewide meeting. So I'll send an email out sometime, I don't know when, far, far away from now, and figure out when our next meeting will be after the statewide meeting. So, all right. Thanks y'all for being here and see you soon. Bye.